Hi guys, the new Health Secretary Therese Coffey, yes, Therese Coffey, spoke to Nick Ferrari on Thursday about what her department is going to do to deal with the massive waiting period for GP appointments. Now, she as usually dodged many of the questions and avoided being pinned down on any specifics or any real solutions. But what she really plans to do, which I'll get to in just a moment, is extremely worrying. First, let's have a listen to what she had to say.
But let's go to one of the big announcements, in fact the biggest announcement really from the government today, which is our plan for patients receiving easier access to NHS and social care. And we turn to Health Secretary and Deputy Prime Minister Therese Coffey, who joins me now. How are you going to mandate that doctors see patients within a certain time frame? How will you actually bring that about? Health Secretary, good morning.
Good morning, Nick. Well, patients are clearly my top priority, and when we've been talking in a different way about developing plans for prevention, very clearly patients often express their frustration about they can't get to see their GP. That's why we've been looking in detail, and we can see a wide variation across the country, but I'm conscious that I will be setting, and am setting those expectations, that we want GPs to see patients driven by clinical needs. So of course some people will need to be seen the same day, and many GPs do this brilliantly already. But what I am aware of is that we need to work with the local NHS to help practices to perhaps share best practice on how we can improve that performance and meet the expectations of patients so they can get to see their GP when they need to.
When you say see, Secretary of State, do you mean see, or does that include a telephone or video consultation?
Well, I think that's open to the relationship between the GP and the patient. I know that throughout the pandemic, there's been a variety of ways that people have interacted with seeing their GP.
So it could include a telephone call?
I'm not going to be overly prescriptive. I know that some people enjoy just having a phone call, but may need to go in and see the doctor. I know that other patients are very keen in that regard. But the important thing is, Nick, that it's only in the last week that we've been getting data out of NHS Digital, and we can see that wide variation. And more than half of practices are already meeting expectations. I want to make sure that we're targeting some help and support to share best practice so that we can satisfy more generally the needs of patients when it comes to accessing primary care. Because we should remember that is the primary route for people to get into the NHS.
Now, according to iNews, to deal with this backlog, Coffey is planning to call on volunteers to help, along with removing requirements for some medicines to be supplied with a prescription. The article says that in a similar way to the way members of the public were recruited during the pandemic to operate call centres for test and trace, these people will fill non-clinical roles. However, they will need to be trained and likely have access to NHS systems, which could create some problems. Now, patients have been struggling for years to get GP appointments, with one solution being that all pharmacists be given a bigger role, but this has done little to dent the waiting times. Technology has also been presented as a solution where patients who don't need to see their GP can get a Zoom call or something similar, but while that sounds good on paper, it has done little to ease the strain on doctors themselves. The core problem here that Coffey and previous health secretaries have ignored is the lack of staff. Helen Buckingham, the Director of Strategy at the Nuffield Trust, said that while the government was right to look at easing pressure on GP services, the truth is that we are chronically short of GPs, with the number of GPs per person in England falling year after year. She went on to say, targets don't create more doctors. Government should step back from the micromanaging timescales for appointments and instead focus on the outcomes that they want to see in primary care. On technological solutions, she said, with a cloud-based telephone system set to run alongside the NHS 111, the NHS app, phoning out of hours and a multitude of other ways to access care, we risk simply proliferating ways for patients to find out the ugly truth of general practice. There just aren't enough doctors to go round. Now, the plans presented by Coffey have also been criticised by trade unions representing NHS workers, saying that more people need to be recruited and better pay and conditions need to be presented by government to new and existing staff. Both the NHS and social care are facing a staffing crisis, and technological solutions and hiring volunteers will not fix that. Coffey needs to work with the Home Secretary to issue new visas and to make it easier for staff from abroad to work in the healthcare sector. She needs to provide real financial support for training up new doctors and nurses and improve the pay and working conditions for existing staff. The Tory solution may be just to let everyone go privately, but as we know, there aren't enough staff. Let me know in the comment section, guys, what you think. As always, your comments are greatly appreciated. Thanks a lot.